May peace be on all of you. Myself, Dr. Majid Khan, Associate Professor, Loknitya Dr. J.D. Pawar College of Pharmacy, Kalwan, Nasik. Today we will discuss about the small chapter anti-leprotic agent. The learning outcome. After completion of this topic, student able to remember classification of anti-leprotic along with the example of drug, understand mechanism of action and SAR of some important anti-leprotic drug. So the leprosy, also known as Hansen's disease, it is a chronic infectious disease caused by Mycobacteria leprae. It is a causative agent, Mycobacterium leprae. This disease mainly affect skin, peripheral nerves, mucosal surface of upper respiratory tract and eyes. Sulfones are the drug which are used in leprosy. So anti-leprotic agent means these are the agent which are used in treatment of leprosy. Sulfone, it is a diaryl sulfone, represent the major class of agent used to treat leprosy. The discovery of sulfone come with the SAR study of sulfonamide. So here there is a comparison of sulfonamide and sulfone. This sulfone, the chemical name is 4,4-diamino diphenyl sulfone. In short, DDS, D for diamino, D for diphenyl, S for sulfone, and the general name is called as dapsone. So it is a dapsone called as DDS. So here there is a comparison between sulfonamide and sulfone. So sulfone is a diaryl drug. There is a 2 aromatic ring. So the discovery of this sulfone is related with SAR of sulfonamide. So here there is a 2 aromatic ring on sulfone. Then the classification of anti-leprotic drug. First one is sulfone derivative, example dapsone or and acetosulfone. Second one is phenazine derivative, example clophazamine. Third one is cyclopentene derivative, example chalmogric acid. Fourth one anti-TB, example rifampin, ethionamide. And other antibiotic in that fluoroquinolone antibacterial, example ofloxacin. Then macrolide antibiotic, example clarithromycin. Tetracycline antibiotic, minocycline. So it is the classification of anti-leprotic drug. Now see the first drug, that is dapsone. It is also called as DDS or 4,4-diamino diphenyl sulfone. So it contains 2 aromatic ring. So in case of SAR of dapsone, the first point is a replacement of benzene ring with thiazole ring. It gives thiazosulfone. So here benzene ring is replaced by the thiazole ring to give new drug thiazosulfone. This drug is less effective than dapsone. Second point, substitution on benzene ring reduces the activity but increase the water solubility and reduce the GIT irritation. So here there is a substitution on aromatic ring or phenyl ring, due to which activity decreases but water solubility increases and there is a reduction in GIT irritation. So it is the acetosulfone drug. Next point, addition of methane sulfonate to dapsone give sulfoxane prodrug, which after hydrolysis converted into dapsone. So here there is a methane sulfonate on both side substituents. So it is a prodrug. So this sulfoxone sodium, after entry into the body, it undergo hydrolysis and again converted into dapsone. So it is a prodrug for dapsone. This drug, that is sulfoxane sodium, is used in individuals who are unable to tolerate dapsone due to GIT irritation, but it must be used in a dose 3 times that of dapsone because of insufficient metabolism to DDS. So it is a prodrug. It converted into dapsone by hydrolysis in body. Therefore the dose is more, that is 3 times than that of dapsone. This drug also used in dermatitis, also used in spider bite, and also used in inflammatory bowel disorder, leishmaniasis, and connective tissue disorders. Now, mechanism of action of dapsone. So, it is a bacteriostatic agent. To it act in similar manner to that of sulfonamide. So, the mechanism of action of this dapsone is same as sulfonamide through competitive inhibition of PABA. So, this dapsone act through competitive inhibition of PABA, that is incorporation of PABA into folic acid. Bacteria synthesize folic acid, but host cell do not. As a result, co-administration of dapsone and PABA will inactivate dapsone. The dapsone and clophazamine as anti-inflammatory agent used for erythema nodosum leprosum in bracket ENL. So ENL means erythema nodosum leprosum. It is the symptoms of leprosy. Here erythema means red, nodosum means nodule-like structure, leprosum means leprosy syndrome. So these are the symptoms of leprosy. So dapsone along with clophazamine used in treatment of ENL symptom of leprosy. So regarding mechanism, it acts similar manner as sulfonamide, that is by competitive mechanism. It inhibits the incorporation of PABA, therefore no formation of folic acid or folate, and therefore there is a no conversion of DUMP to TMP. So it is about the mechanism of action of dapsone. Now next drug is clophazamine. So it is a structure of clophazamine. Clophazamine. So numbering is given 1, 2, 3. Here is 7. Here is 10. Then SAR. First point, immunofunction at position 2. Immunofunction means this one. Nitrogen attached with double bond. Immunofunction. Then para-chloro substitution on phenyl ring. So it is a para-chloro substitution here also, here also. At position 3, at position 10 and at position 7 there is a para-chloro substitution has been investigated. Second point, immunofunction is essential, and if amino group is substituted with alkyl and cycloalkyl group, the activity increases. So here there is a alkyl group on this immunonitrogen, activity increases. Third point, halogen on para position of 2 phenyl ring at position 3 and 10 increase the activity. So mainly on 3rd, on 7, on 10 there is a para substituted phenyl ring, and this para substitution is halogen. So here the order of halogen is bromine, chlorine, methyl and ethyl. It means that if bromine is present on para position of phenyl ring, it gives more activity as compared to if it contains chloro group. Similarly, if compound contain chloro group, it gives more activity than the methyl and ethyl group. So on 3rd position, on 10th position there will be phenyl ring, and which contain the halogens, mainly bromine, chlorine, or sometime methyl and ethyl. So it is the SAR of clophazamine. Now mechanism of action. The mechanism of action of clophazamine is remain unclear. It has been shown that clophazamine increase prostaglandin synthesis and generation of antimicrobial reactive oxidant from neutrophil, which play important role in anti-leprotic effect. The host cell defense may be stimulated by clophazamine, resulting in generation of superoxide anion, which having lethal effect on organism or microorganism. It also binds to guanine base of DNA of bacteria. It also increase activity of bacterial phospholipase A2 leading to release and accumulation of lysophospholipid, which are toxic to bacteria. So it is about the mechanism of action of clophazamine. Thalidomide, next drug is thalidomide. So it is the structure of thalidomide. The development of painful inflammatory subcutaneous nodule referred as ENL, which is a symptom of leprosy. In addition to painful nodule, the patient may experience fever, malaise, that is feeling of discomfort, and peripheral neuritis. This condition is successfully treated with thalidomide. Recently, racemic thalidomide has been approved by FDA for treatment of ENL and considered as a drug of choice. The mechanism where the thalidomide produces relief is thought to be associated with its ability to control inflammatory cytokine. Cytokine is an inflammatory intermediate. Thalidomide especially inhibits the synthesis and release of tumor necrosis factor, that is TNF. TNF, tumor necrosis factor. The TNF is synthesized and released by blood cell and appear in serum during ENL symptom of leprosy. The concentration of TNF fall down when the patient is treated with thalidomide. So it is the use of thalidomide, and it is about the anti-leprotic chapter. So if you like the video, then subscribe the channel. Thank you very much.